काम को दोनों को संभालना होता है।
नहीं मुश्किल नहीं होता है, आसान हो जाता है पूरा। उसमें क्या है?
मुश्किल को नहीं है, आसान है। बोले ना।
नहीं थोड़ा सा मुश्किल होता है।
Neha, a flower seller by profession. She's here at Central Mumbai's crowded flower market in Dadar at 4 a.m. each morning. Her day ends at 8 in the evening. The 16-hour days at work bring her just rupees 10,000 to 12,000 per month. And guess who accompanies her to work on the pavement every day? Her 11-month-old girl child. She plays, sleeps here. Neha, who's still breastfeeding, is unable to find a private space for herself in the crowded Dadar market where she nurses her baby.
हाँ यहाँ पे रहते हैं, यहाँ पे कोई लोग नहीं आते उसकी मदद करने के लिए।
तो वो खुद ही संभालते हैं।
हाँ खुद ही संभालते। बहुत मुश्किल होता है, बच्चों को संभालो, ये फूल बेचो, गिराक लोग को दो, मतलब ज़्यादा करके उसका समय बच्चों को संभालने को जाता है, माल बेचने को जाता है, बच्चा बहुत रोता है।
Childcare is a massive challenge for working mothers, especially in the informal sector, which employs 88% of the women. 73% of Indian women leave their jobs on giving birth, as per a 2018 report. 48% of those who return drop out within 4 months of rejoining the workforce. For the rest, like Neha, who simply cannot afford to quit, every day is a challenge. But it is not just the mother who suffers.
It was the construction laborers and the street vendors who were actually carrying their children to the work site. Now that was of course leading to a lot of nutritional deficiencies because they are obviously, the child is not in a safe environment, and the child is also not getting access to good quality nutritious food as well. Simultaneously, these women were also queuing up to get food rations and packets during the lockdown. So there was that added stress as well, and they were carrying their children. So clearly during that time, nutrition levels definitely suffered.
Now, COVID is an additional burden for women with kids not in school. As per a LinkedIn survey, 47% of working women are facing more stress and anxiety due to the pandemic, as they share majority of the childcare burden. Women's time spent on childcare tasks has increased by 34%, compared to a 29% rise for men who were performing far less to begin with. And that's not all. Mothers of young children also pay a penalty in terms of pay and access to leadership positions. Just 16% of women who re-enter the workforce manage to enter leadership positions. Is this reversible? Can women do better with assistance from family and employers?
There are NGOs, etc., who keep actually recommending, like mobile creches, for example, that in construction work sites, there should be, creches that have to be provided, and the NGOs have been providing that on their own account. And the second sort of creche facility, things that are now that the government is considering is really extending under the National Education Policy, the working hours for Anganwadi centers in rural areas, so that at least the 0 to 3 age group, which is really the most critical time, is not actually covered by the Anganwadis. So convert Anganwadis into full childcare creches. So not only does the child get nutrition, but also some early stimulation. If you start inculcating attitudinal behavior amongst adolescent boys, particularly at the school level, on how they need to share the burden, and of course in all other sort of campaigns that are being done around sharing the workload, that helps at the family sort of level. Can you explore maybe getting a woman who gets paid in a public-private partnership? So the woman gets trained as a childcare creche provider, and the government ensures some minimum quality norms are followed, even in her small house in the slum, which she converts as a creche facility.